Welcome, listeners, to another My Mind MashUps deep dive, where we unravel mysteries, spark curiosity, and make sense of complex ideas together.
It's great to be here. Today, we've got quite a hefty stack of sources. We're talking research articles, deep analyses, some expert notes, all to tackle a subject that, sounds a little dry on the surface.
It really does. Healthcare insurance.
Exactly. But it's so intimately tied to your survival, your finances, and even your freedom.
That's it. We're trying to move beyond just the policy documents to see how insurance is connected to, well, everything. Our health, our money, even the jobs we feel we can or can't take. This whole deep dive is about risk and how the system that's supposed to manage it
Often just shifts that risk right back onto you.
Precisely. Our mission here is to give you a shortcut to being really well informed on this. We want to challenge some assumptions and maybe expand your understanding.
And we're going to do that by looking at the human emotional impact first, before we get into all the cold, hard data.
And of course, if you enjoy content that makes you think, don't forget to like, share, and subscribe. Okay, so let's unpack this. When we hear about the rising costs of healthcare, what does that actually mean for an average person right now?
Well, the numbers really aren't just statistics, They are, in a way, predictors of human behavior. Healthcare spending is projected to jump nearly 9% in 2024.
Wow. 9%.
And that's after an 8.2% jump the year before. So this isn't just like a blip of inflation. It's sustained. It's compounding.
And that rising cost, that creates a real human dilemma. The sources we looked at show that back in 2022, over 28% of adults, they just decided to put off essential medical care.
Essential care. So we're talking about seeing a specialist, getting tests done.
Or even just filling prescriptions, all because of the cost. And if you're uninsured, that number shoots way, way up.
Just think about that for a second. That's almost 1 in 3 adults in, the most powerful economy on the planet actively deciding not to get care.
They're running a cost-benefit analysis in their head.
Totally. It's, can I afford this bill, or do I just risk my health long term?
And that fear, it dictates so much more than just health choices. What the research really uncovers is how employer-sponsored insurance creates this thing called job lock.
Right. Job lock.
You could absolutely hate your job, or maybe you have a brilliant business idea you want to get off the ground, but you're stuck.
You're financially chained to that employer because it's the only way to get decent coverage.
Exactly.
I mean, imagine you're the parent of a child with, say, type 1 diabetes. You need that continuous access to insulin, to monitoring supplies. That coverage is a literal lifeline.
You can't risk it.
You can't risk switching jobs.
Yeah.
You can't risk starting that company, no matter how great the opportunity is, because any gap in coverage could mean, bankruptcy or worse.
So there's this weird paradox, right? The system that's supposed to manage risk is actually crushing economic risk-taking. It's stopping people from moving forward.
Absolutely. The sources draw a really strong line here. You see economists linking countries that have universal healthcare systems to, statistically, much higher rates of entrepreneurship and small business creation.
So the freedom from that fear.
The freedom from that fear of losing coverage directly creates the freedom to innovate.
That context is just critical, and it makes the policy debates feel a lot less abstract. Which, of course, brings us to the biggest structural debate of all.
The single-payer solution.
This is often framed as the massive alternative, right?
It is, and we should probably define it simply. Single-payer just means one entity, usually the government, is responsible for paying for everyone's essential care. Think of it like expanding Medicare to cover everybody.
But the second you say that, the conversation slams right into the cost barrier. How on earth do you fund something that massive? Our sources definitely highlight that.
They do. And look, implementing single payer means you have to replace all the money that employers and individuals are currently spending on premiums, on deductibles, copays.
So the money doesn't just vanish, it just has to be collected differently.
Precisely. It's a shift in how the money flows, not necessarily more money overall. But to cover that huge expense, the sources talk about options like a 32% payroll tax.
Whoa.
Or a 25% income tax, or maybe a broad consumption tax, like a VAT.
Can you just quickly explain what a VAT is for anyone listening?
Sure. A VAT is a value-added tax. You see it all over Europe. It's a tax that's applied at like every stage of a product's creation and sale. It's a way to generate huge revenue, but it does hit everyone who buys anything.
Those are some eye-watering numbers for sure, especially when taxes already feel so high. But let's look at the other side of the coin, the efficiency argument, the idea that you could have these massive savings.
Right, because the current system is so fragmented and so complex, it leads to this incredible amount of administrative waste. One estimate suggests that just moving to a single system could save over $450 billion a year in the U.S.
Wait, say that again? 450 billion.
Billion.
With a B. That is an astronomical number. Where would that money even come from?
It's mostly two areas. First, you cut way down on the just mountains of administrative paperwork from hundreds of different insurance companies, all playing by different rules.
Okay, that makes sense.
And second, and this is crucial, lower drug prices. A single national system has immense power to negotiate prices with pharmaceutical companies, much more than individual insurers do now.
But okay, let's be realistic. If you're going to save $450 billion by cutting administrative jobs and forcing down drug prices, aren't those industries going to fight that tooth and nail?
And that's the primary political barrier the sources point to. The sectors that would lose all that revenue, the insurance companies, the big pharma corporations, they have enormous lobbying power.
So it's not a technical problem, it's a political one.
It's about overcoming these powerful incumbent interests who, benefit from the complexity we have now.
Okay, so beyond the cost, the number one fear I always hear about universal systems is wait times, long waits to see a doctor or get a surgery.
It's a common concern and a valid one. The sources address it directly. And they emphasize that the solution isn't just throwing more money at hospitals. It's about shifting the focus to prevention and primary care.
So the idea is if everyone has a regular doctor for checkups, you prevent small problems from becoming huge, expensive emergencies down the line.
Exactly. It's proactive maintenance versus reactive crisis management. It's like with your car, right? Yeah. Regular oil changes avoid the engine blowing up on the highway, which costs 10 times more to fix.
Right.
If you invest in really robust primary care, you stop little health issues from becoming big, expensive, life-threatening ones.
And let's tackle that other myth. The idea that the government will choose your doctor or dictate your care. A lot of people fear that.
And the analysis we looked at hits this head on. They note that in most successful universal systems around the world, you still choose your doctor. You and your doctor still make the treatment plan.
So the government is just the payer.
They're the payer and the regulator. They set standards and ensure everyone has access, but they are not in the exam room telling your doctor what to do.
Okay, so if we're not going to do a massive overhaul tomorrow, what are the practical, immediate steps we could take to modernize things?
Well, one thing that became painfully obvious during the COVID-19 pandemic was the desperate need to modernize our public health data systems.
It's the basic infrastructure, the foundation.
It's the roadmap. You need good, fast, unified data to track health trends, to see the disparities between communities, and to allocate resources efficiently. Without good data, we're just flying blind, spending billions.
We need that integrated roadmap to a healthier future.
Absolutely. And then beyond data, we have to tackle the massive problem of drug costs. The sources point to two key solutions that could have an immediate impact.
Okay, what are they?
First, streamline the approval process for generic drugs. Generics create competition, and competition brings prices down. Second, and this is a big one, give Medicare the power to negotiate prices directly with drug companies.
Which it currently can't do for most drugs.
It is explicitly barred from doing so.
Now, the classic counter-argument to negotiation is always about innovation. The idea that if drug companies can't charge these huge prices, they won't have the incentive to do the expensive R&D.
Right, that's the pushback. And it's a valid economic concern, but the sources offer some really sophisticated responses. They suggest alternative funding models.
So, ways to keep innovation going without relying on sky-high prices for consumers.
Exactly. For example, instead of the company hoping to make a massive profit after a drug launches, the government could use grants or prize systems.
A prize system? How does that work?
The government basically pays the company a huge prize up front once they've successfully developed a truly new life-saving drug. Then the patent could be released for generic production right away. So the public gets access, the innovator gets paid handsomely for their work.
And the incentive shifts from high prices to pure scientific achievement.
It's a fundamentally different way to think about it. It ensures innovation and affordability can actually coexist.
If this is resonating, hit that subscribe button so you don't miss the next deep dive. Okay, we've talked about money, policy, structural reforms, but sometimes the biggest barriers to health aren't in a policy manual, they're in our culture.
That's right, and that brings us to a really significant disparity the sources highlighted. We're shifting focus a bit now to how social factors influence health, specifically looking at the life expectancy gap between men and women in the U.S.
Give us the numbers on that. How big is the difference?
In 2022, men's life expectancy was 74.8 years. For women, it was 80.2.
Wow, that's more than a 5-year gap.
It's a huge, persistent gap, and the sources are clear. It is not just biology.
So what are the non-biological factors driving that?
It's multifaceted. I mean, men do have higher rates of chronic diseases like heart disease and cancer, but social factors just make those problems so much worse.
Like what?
Well, men are overrepresented in riskier, more physically demanding jobs, for one. But more profoundly, there are these deep-seated cultural pressures.
The whole be a man, be tough, don't complain kind of thing.
Exactly. That cultural norm of stoicism. The idea that showing vulnerability is weakness. It translates directly into men delaying or just flat out avoiding essential medical and mental health care.
So they wait.
They wait until a small, manageable problem has become a major, life-threatening crisis.
And I can see how that just snowballs. Delaying screenings, not managing stress. Yeah. It all leads to worse long-term outcomes.
It really does. It feeds into higher rates of substance use, delayed cancer screenings, missed chances for early intervention on heart disease. The sources are really clear that fixing this requires cultural solutions, not just clinical ones.
So how does a system even begin to tackle something so deep-seated?
By meeting people where they are. This means expanding things like community health centers and, crucially, using community health workers.
And those are trusted people from the community, right? Not doctors.
Exactly. They're trained to help people navigate the confusing system, address skepticism, and focus on what we call the social determinants of health.
Things like stable housing, good food, economic security.
All of it. It's a holistic approach. You're not just treating sickness in a clinic. You're addressing the root causes of poor health in the community itself.
Yeah.
You're making the whole population healthier to begin with.
Which is a huge shift. We're moving from just insuring people for when they get sick
to actively engineering healthier communities. And technology is playing a really major role in that shift.
The digital revolution in healthcare has just incredible momentum. I mean, telehealth usage exploded during the pandemic.
And the benefits are obvious. Access for rural areas, seeing specialists who are hundreds of miles away, and just simple convenience. No travel, no missed work.
And then there's remote patient monitoring, or RPM. That seems like a total game changer for chronic conditions.
It really is. The sources cite digital diabetes care as a perfect example. You can track blood sugar or blood pressure remotely, and that allows for immediate intervention if the data shows a problem is starting.
And for people managing those illnesses, RPM has to be a huge financial win too. It must save a ton of money by preventing those expensive, unplanned ER visits.
Which brings us to the big so what question. As all this technology gets better and better, we have to address privacy and accessibility. It raises the question, is this tech making healthcare more fair for everyone?
Or is it just benefiting the rich and tech savvy, the people who already have stable internet and all the latest devices?
That's the risk. We have to make sure that technology is used to close the health gap, not widen it. If we don't, we risk creating this two-tiered system where only some people get the benefits.
That is the equity challenge of this whole digital health revolution. It requires really careful planning.
It does.
Like, comment, and subscribe to hear more My Mind MashUps deep dives. We cover some really complex ground today. The emotional cost of rising premiums, the massive trade-offs of a single-payer system, and some immediate fixes like drug negotiation and data modernization.
And the role of tech and that profound influence of culture on our health, like with the men's health gap.
I think the big takeaway for me is that insurance is just so much more than a boring policy document. It is tied to your health, your money, your personal power.
It really is. And understanding the system, knowing your options, that gives you crucial control over your own life. The journey toward a better system really requires curiosity and action from all of us.
The insights we pulled today really show that structure and culture both matter so much.
Which takes us back to the beginning data. We talked about how better data systems are essential. So here's a thought. If we could magically track every person's anonymous health data perfectly and use it to maximize policy success, which are the three big ideas we talked about today? Single payer, primary care expansion, or giving Medicare negotiation power do you think would deliver the fastest and biggest improvement to the system?
That is a great reflective thought to end on. Drop your thoughts in the comments. Your perspective could shape our next deep dive.
Find My Mind MashUps everywhere you listen. Amazon Music, Audible, Facebook, Pocket Casts, Spotify, TikTok, and YouTube.
Stay curious, stay engaged, and stay well.